Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my special guest is Dr. Alan Larsen. Dr. Alan Larsen is a plastic surgeon in Buckhead, Atlanta. He owns Buckhead Plastic Surgery, and he helps men and women achieve their desired cosmetic goals. Welcome to the show, Dr. Larsen.
Thank you, Neil.
Well, tell me a little bit about yourself, how you got started in plastic surgery, maybe a little bit about your education as well, and how you ended up in Atlanta.
Okay. Well, it started when I got pretty sick when I was 10 years old and decided I wanted to be a doctor. Didn't know what type of physician I wanted to be, but just wanted to be one. And before that, I'd always wanted to be an astronaut. So I also ski raced, so I was a professional ski racer. And when I quit that, I went back to school and studied at the University of Nevada, Reno, and went on to medical school at the University of Nevada in Reno. From there, I graduated and did a general surgery residency at the University of Florida. And in my first year in that residency, I thought I wanted to be a pediatric surgeon. And I did a rotation in plastics and just fell in love with it. Dr. Glassman, who was the program director, he just was a phenomenal surgeon and sculptor. And we did a lot of craniofacial cases, making kids look better with cleft lip, palate, and other things. And then just everything else about plastic surgery, from breast augs to liposuction and body contouring, just fell in love with it. So from then on, I wanted to be a plastic surgeon. And when I graduated from the general surgery program, I went off to Bowman Gray School of Medicine in Winston-Salem, North Carolina, where I finished a 2-year plastic surgery program with Dr. Argenta. And from there, it led me to Atlanta, where I took over the practice of a former Bowman Gray plastic surgeon because she got married and moved to Dallas. So that's how I became a plastic surgeon and made it to Atlanta. And I've been here for about 20 years now.
Well, you certainly got some education and experience. So with all that education and experience, you must have a lot of people coming to you for your service. Tell me, what is it about your service that people come to you for? Like, is it breast augmentation? Is it the CoolSculpting that seems to be very popular nowadays?
So I think patients come for everything. I'm really well known for doing body lifts and the large major surgeries that go along with weight loss, either from weight loss surgery or people that have lost a large amount of weight on their own. So I'm known for that, and we do a lot of those procedures. The newer procedures are coming on, and they're gaining popularity, like CoolSculpting. People don't want the downtime of surgery. CoolSculpting is something that we offer, where you come in, get the procedure, and basically you're finished. And about 6 to 8 weeks later, you have your results, and you've only taken out an hour of time from your day. So those are nice procedures that are coming on. Other than that, I do a multitude of facial procedures, facelifts, eyelid surgery, nose reshaping, and then of course everyone does a lot of breast augmentations, breast reductions, and again back to the body contouring. An exciting part of my practice that I added about 8 years ago, I was asked by a breast surgeon to do his breast reconstructions. He had used almost everyone in town and off and on was happy and unhappy with the results. So I started doing his breast reconstructions, and we've been a team for about 8 years now. We have some of the lower complications in the country, and we're pretty proud of that. And that's been a really nice change to my practice, not only helping somebody who wants a change for their own personal reason, but restoring a very important part of a woman's, anatomy and
it seems to be a big problem with breast cancer. It's not something that's going away, and to be able to make a difference like that to a woman's just everything, get her shape back and her confidence back, it must really give you a good feeling to be able to help in that way.
It's a great feeling, and you see them. Everything happens pretty fast, from the diagnosis to the loss of their breast to the reconstruction happens pretty fast. And to see the lady get her self-esteem back, and then even to go on and talk about their breast reconstructions and talk to other ladies about how much it's improved their life and how they feel whole again. That's been a great aspect of what I do.
Well, let's talk a little bit about the weight loss surgeries that you do, seeing as that is one of the major things that you're known for. Talk to me about some of the problems that people come to you with that might have just lost a lot of weight. Is this something that you deal with people that have just lost a lot of weight, or is this to enable them to lose some more weight?
Well, depending on the stage of their weight loss or the program they're in, it's a finishing touch, but it also is used often to help them get over a hurdle and go on to lose more weight, and even be able to work out harder and do things they couldn't do before. And an example is somebody who has lost all of the weight. We can tighten up their arms and tighten up their breast or chest, take out all the extra skin around their abdomen, lift their bottom up, tighten their thighs so they don't touch or rub in the middle. And, it's kind of the finishing touch of maybe somebody who loses 140 pounds. And it just, it brings out that glow in the person, and they've in the first place, they've accomplished one of the greatest goals I think you can do in the United States, and that's probably to lose weight, only followed by probably stopping smoking cigarettes. But, so they've lost this weight after years of, eating incorrectly or just learning to eat wrong from the time they were a child. And then there's the other patient who is still very large, and maybe extremely large, and they have so much extra skin and extra tissue, especially on their abdomen, that it hinders them from even being able to work out. And one of the last patients that comes to mind, she's an older lady, about 62, is trying to lose weight, has arthritis that has absolutely just crippled her, where she's in a wheelchair. And she said, "Doctor, can I get rid of this skin and hanging tissue on my stomach?" And we did, and without any complications or anything. The last time I saw her, she came walking into the office with a cane. So we did take off about 40 pounds, I think. So in that regard, actually, yes, taking off skin or fatty tissue in the middle allows the patient to further get up, move around, increase their activity during the day, and further go on to weight loss and have health gains that go along with it.
Yeah, there seems to be two really distinct areas within plastic surgery. One is, the cosmetic side, maybe just getting that perfect body that you've been working towards, and then there's the functional side as well, to where, you know, maybe you've done that work to lose 140 pounds, like you've said, and you're left with some problems. Give me an example of some of the problems that people have, like we just talked about. If they lost 140 pounds, what are they faced with, and what problems are they having?
So, you know, when you lose the weight, unfortunately, your skin isn't just going to go back to that runway model, or the guy in the gym that's working out with weights, and the skin gets stretched out, and depending on the area of the extra skin, it just gets in the way. And so, for instance, you know, shirts don't fit right, and for your arms, and maybe because of the extra skin, there's excess sweating and rashes that develop and stuff. And that goes on the same with, you know, in the chest area. They can have so much extra skin that bras don't fit right. They actually cut into the skin because it's pressure points between the bra and the extra skin. Can happen. Rashes under the breast, especially I'm in Atlanta, so the heat and humidity in the summer, it worsens. And then keeping the area clean, and everything on your lower abdomen and in the pubic area, they get rashes and hard to keep clean and dry. Clothes are difficult to wear. You can find a nice, you know, the patient loses enough weight to be in a 4 dress, but there's so much extra skin there, they're still in an 8 or a 9 just to cover it up. So these things impact that. And then physically, if you know, when you go to lose that kind of weight, you just didn't do it because you sat on the couch. These people become much more active and everything, and that extra skin, like your thighs rubbing or in your abdomen or breast, it makes it hard to work out. You can't find clothes that can hold it into place and keep it from becoming a problem. So removing it puts that patient now past that, and it's just kind of the end of their story of weight loss, and moves them forward. And it does everything from changing the jobs they get because they're a new person, to new loves and everything in their life. Thinking back on one of these patients, I had a nurse who lost 140 pounds. She started gaining weight when she was about 19 years old. And she sent me a picture. She is 42 years old. She's on the beach. She has a boyfriend. And she's in shorts and a shirt. But she had not been to the beach since she was 19 years old. So some of those things are just kind of fantastic progressions of what we see when both are done. She did the hard work of losing weight, and we took care of getting rid of the extra skin so she could feel comfortable and confident on the beach.
Yeah, I mean, going through the exercise just to lose that kind of weight is a huge achievement, but oftentimes there's still that mental aspect when you know that you have the skin still extra skin waving around. It does give you that self-consciousness, and maybe it doesn't give you the confidence that, you know, a procedure might help you with. So describe what kind of procedure you would do in that case, maybe how long it takes. Can you do everything at once, or does it take different sessions? And what kind of recovery time are we looking at?
So, you know, I started doing the body lifts 20 years ago, and at that time there were probably only a couple of physicians in the country even doing them. And you know, I looked at the risks of this surgery, which is big, and just formulated a plan in my head. What would be the safest route to go for patients? And, you know, knock on wood, I've had one patient end up in the hospital after a large procedure, and it was anesthesia related, not necessarily my surgery related. And so we've done very well with doing safe procedures, but I kind of break them up. And what I look at is a patient needs to get up and moving around after surgery to have a safe surgery and not have problems with like blood clots in their legs and those things breaking off and going to heart and lungs. So I think when you operate on the abdomen, and that would be either an abdominoplasty or a body lift where you take skin and excess tissue off all the way around your abdomen circumferentially. I think when you do that, and I have the patients bent over, one is it's a very painful procedure. So it's difficult for people to get up and move around, and I want my patients to get up every hour and walk around to decrease those complications. And then so if you add a thigh lift to this, or you add arms to this operation, now you have somebody who has pain in their abdomen, pain in their legs, and pain in their arms. There's no way to get that patient up and out of bed or up and out of the reclining chair and get them moving around. So I break it up. I will do breast surgery with the body lift. I will not do arms, and I will not do legs. And in this town where doctors still do either 2 or 3 of those procedures together, there's quite a few people that end up in the intensive care unit and in the hospital for 3 or 4 or 5 days recovering from these things. So I do break them up. Times-wise for surgery, if you do the body lift and a breast lift, that's about 8 hours of surgery, and that's about enough for anybody. The body lift itself is about 5 hours. A tummy tuck in my hands is about 3 hours. I pride myself in the incision, keeping it low, keeping it hidden, keeping it in a bathing suit. And so it takes a little longer for the technique I use than some of the other techniques where the incision may just go straight across the lower abdomen.
And talk to me a little bit about the safety. You mentioned that it's very important that your patients get up and move around. What other issues might somebody that is considering a surgery like this need to know before going ahead with it?
Well, all surgeries have their risk, and they run from what anesthesia adds, and those are things like maybe a pneumonia, and that's probably 50-50 anesthesia and the surgery, because people don't want to get up, they don't want to cough and deep breathe, and they've had anesthesia. We're all at a little risk for that when we have it. So there's things like that are probably milder and can be treated with an antibiotic. And then the complications go to things like the blood clot in your legs could break off and go to your heart and lungs. That's a serious complication that I go out of my way to have the patient try and not develop. It's easier to prevent than it is to treat. And then there's things that are very mild, along with maybe a little breakdown in the wound that's a centimeter or centimeter and a half long or inch long, let's say, that heals up very easily. You can get fluid collections as well. Those are kind of easy to take care of. Most of the other complications are pretty easy, but I think the biggest one is keeping that blood flowing, keeping your lungs open and free of any kind of infection like a pneumonia. And we work very hard at keeping people to do that. So
you've got 2 offices or 2 areas anyway within your practice, Dr. Larsen. You've got the plastic surgery, which is probably to do with the bigger surgeries. And then you've got the Luxe Med Spa. Tell me what the Luxe Med Spa is.
So the Luxe Med Spa is it's a spa that we opened now, I think about 2.5 years ago. And, patients, for instance, when you do facial rejuvenation and you've tightened the skin and you've gotten rid of the extra skin on their eyes and no more bagginess underneath and their brow is in the right position, a lot of these ladies still have old looking skin. And that's just from sun damage. They have dark and light spots, red spots, and blemishes. And overall, as our skin gets older, it becomes more dull. And if you ever look at a family picture where grandma's in it and the baby's in it, the baby has this shiny, bright skin, and grandma has the dullest skin. So it loses that luster. And so the med spa was a way to add procedures with like broadband light treatments and chemical peels and some things like that are easy to have done. They come in the same day, you leave the same day, you leave an hour later, and to rejuvenate the skin tones and colors. So that was one of the reasons to do it, and that adds a fantastic benefit to somebody who's just spent a lot of money having a facial rejuvenation facelift. And then there's the other parts of it. CoolSculpting is a little separate from our spa, but the spa also offers massages. And what I say by that, it's a special massage. It's called a lymphatic massage. And that helps drain fluids from tissues that have been operated on. And you can have a lymphatic massage in anywhere from your face, your breast, your chest, your abdomen, your legs after liposuction. And it just speeds the comfort and the healing after you've had surgery. So we added the spa for that. And then we also carry medical grade skincare products, which are all an added benefit. So it's been a really nice adjunct to our surgical treatments.
Very good. Now tell me, where do you think plastic surgery is moving in the future? It's started after World War I believe, for a very functional reason, but it is certainly moving at a fast pace, and there's always something new happening. Where do you think plastic surgery is moving?
Well, I think the goal would be to have to get the perfect treatment for whatever you would like corrected, with no surgery and no downtime and zero complications. So I think it's moving towards non-surgical treatments. And for instance, CoolSculpting which is one of the newest and greatest treatments in that area. It can reduce about 25% of the fatty tissue in an area with literally no downtime and an extremely safe post-operative profile. So very, very rare complications.
Explain to me how CoolSculpting works.
So CoolSculpting is there's I think a little bit of suction on the machine and cooling, and it cools the temperature of the subcutaneous fat. In other words, that fatty tissue that's below the skin. And by cooling it, you cause those cells to break apart. And when they break apart, then that fatty tissue that was in there is reabsorbed by the body and eliminated. And so over time, and I think it's about 8 weeks or so, full benefits at about 6 months. Over that time, it's slowly reabsorbed, and you notice that you get about a 25% decrease in the thickness of the fatty tissue in the areas that were treated. So that's one of the areas where we're taking away from liposuction that has a little longer downtime, and a surgical procedure plus or minus with anesthesia, and we've brought it to one that has minimal pain or discomfort. You sit in a chair for 36 minutes, I think, for an area, and you're finished. So that's been a great treatment benefit. On the downside of that, you heard me say it takes out 25% of the fat. Liposuction, you probably get to take out about 75 or 80% of the fat. So there's a little downside. You don't quite get the result, but the upside probably in a lot of patients makes up for it by not having anesthesia, not having surgery, and not having a little bit longer recovery period.
And as far as something like CoolSculpting, how often can you have that done?
So we've had patients that have CoolSculpted their abdomen, their thighs, the flanks, which is, the lower part of your back and arms. So they've had multiple procedures done. Patients probably take 2 to 4 weeks off in between treatments. And then if you want to treat an area you've treated before a second time, most patients wait in the 3 to 6 month time area to come back to do that. So if they've treated their tummy once, they like the result, they want a little more result, usually in about 3 to 6 months, they come back and treat that area a second time.
So would you say it was a good practice in conjunction with like a diet and exercise program? If somebody's really looking to lose weight, if they can get 25% of that off with CoolSculpting and, aid the rest with their diet and exercise?
With any of the body procedures that we do, I go out of my way to try and get the patient on a exercise and dieting program. And so I think if you want to keep the results the longest, I think it's essential that the patient do some form of exercise. And what's even more important than the exercise as far as the weight loss goes is your dieting. So our size is treated by what we eat, and our health is treated by exercising. So if you want to be healthy and you want to have the size that's right for you, I think it's a combination of both. You exercise for your health and you eat for your size or body contours.
Well, Dr. Larsen, we've talked about an array of different things to do with plastic surgery today. If there's something that we didn't get a chance to talk about, but you would really like to mention to our listeners, what might that be?
I think facial procedures are something we didn't talk about too much, and I think they are a big part of my practice, and it's what was the ultimate why we put the spa together. And I think that, for the patient that's in their 40s and above, these are the things that start to become a little more important. Looking best for their job interview or when they're up in front of a crowd or audience speaking and things like that. I think then some of the facial procedures come into view. But I think we do a great job in a multitude of areas of plastic surgery, facial being one of them. And then my two favorite surgeries of all are at absolute opposite ends of the spectrum. I love doing eyelid surgery. I think it's extremely precise surgery. I think I have phenomenal results, especially in the lower eyelids, where I preserve fat and kind of just rearrange the lower eyelid and lift it, and which is a very delicate operation versus the body lift, that big procedure I talked about where we remove skin and fatty tissue all the way around the patient's abdomen. I just love that. And the two of them are completely different. Big instruments, big surgery, really tiny instruments in a really tiny surgery. But I think those two are, patients get a lot of satisfaction from them. I think I'm very good at the two of them. And that's kind of my practice. I love doing what I do.
Excellent. Well, if somebody wants to get in contact with you, if they're in the Atlanta area, or I know a lot of people travel a long way to see the right surgeon, how do they get in contact with you at Buckhead Plastic Surgery?
So our website is www.buckheadplasticsurgery.com. You can Google us, Buckhead Plastic Surgery, and there's links on every page, I think, to get in touch with our patient coordinators. If you're in town and you want to call, our phone number is 404-367-9005, and any of my staff will be more than glad to take your call and answer your questions and get you. And if they can't answer your question, they'll get you to the right person that can answer it. And those are probably the two easiest ways to get in touch with us.
Well, excellent. And as far as consultations, tell me a little bit about a consultation, what that involves, and is there a charge for that, or is that something that you provide?
So consultations off and on go with the charge. I think we do charge for a consultation. It's $100. That money goes towards your surgery should you proceed. I think we're busy enough that the consultation is well worth spending the $100, and I think our work goes along with it as well. The consultation is probably somewhere around an hour, sometimes a little longer, depending on the level of questioning and stuff a patient may have. And we try to, when you leave that consultation, you know just about everything there is to know about the procedure you want to have done. You've seen before and after pictures of the procedure, so you can have an idea of what you're going to look like and match what I can do, hopefully, with your expectations. And, I had a lady today send me a picture. She's lost a lot of weight, and she sent me a picture. She wants to look like this lady that's a runway model, and unfortunately, she's older, and no matter what, I don't think we can make it look like that. So, when a patient has that kind of expectation, hopefully by the time they leave here, they have a more realistic expectation of, no, this is what we can do. And if you'd like to proceed with it, we'd be happy to give you this kind of result. And, that's part of the consultation. But it lasts a good hour, and hopefully we answer all of your questions and have you well prepared for surgery should you decide to move forward.
Yeah, I mean, we've talked a lot about different things today, and there's the question and answers in your website and everything else, but ultimately it is an individual procedure, and you need to get all your individual questions answered appropriately. So a consultation seems like the right thing to do. Well, again, Dr. Larsen, thank you very much for being my guest on Business Authority Radio today.
Thank you, Neil. Appreciate you having me on.
And to our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.